Welcome to Between the Chairs. This is our first refreshed, kind of remade version of the Between the Chairs podcast. We're going to be sending out at least a monthly podcast series on different topics going on in the organization. But today, we are going to talk about NADG, the PDA, Professional Dental Alliance. Who are we, the what, the why, the who, and all the different elements that make us the best dental organization in the world. First, I'm Dr. Andrew Matta, Chief Medical Officer and co-founder of North American Dental Group, and I am joined with Dr. George Bruder, who's our Chief of Research and Strategies, and Dr. Frank Nia, who's our Chief Clinical Officer for the company. So welcome, guys. Thank you guys for joining me.
Thanks for having us. Thank you.
Awesome. So there can be a little bit of questions, confusion. The Professional Dental Alliance, NADG, why two names? What's the difference with the organizations? How do the two work together? So we're going to start by just talking about what that looks like and who exactly we are. The PDA, we're a medical group. We are doctor partners that have brought our practices into an organization, other doctors that have become a part of the organization, and are partners together in the company to ensure that we are interacting and providing the best care to our patients. We have a mission. The mission is best-in-class care for every patient, every visit. When you take that kind of mission and you want to thread it into something actionable so that you're measuring what all of that looks like and what that means, we know healthcare is dynamic. There's a lot of different systems at play. There's a lot of different variables. I would say it's probably one of the most complex industries in the world. So having medical expertise is one facet of that. We partner with North American Dental Group. That is our service organization. They have expertise on all the different business elements, finance, HR, legal, etc., and they help us navigate the healthcare system as well as making sure that we are reaching our mission of best-in-class care and helping us execute and implement according to that. So that's where I'm going to start. I'm going to start with the Professional Dental Alliance and that mission. And the mission that I just noted is pretty lofty. The dental industry has been solo practice for how it's emerged and evolved. Solo private practice, I think, has a lot of great elements. We have a number of incredibly successful practices and partners in the company. But taking some of those best practices and then having it be able to have consistent best practices, not across just one practice or a couple practices, but across dozens, hundreds of practices, and in our organization across states. And we'll even reference the partnership that we have with Coliseum Dental Group. How is it that you can start to ensure that that quality of care is present across such a broad network? So that's the strategy side of it. So Dr. Bruder, I'm going to start with talking a little bit about, when we think strategically and we put that as the mission, we have doctors that collaborate together and come together to define a strategy, a vision statement. This is what we want. And then we want to put things in place to be able to realize that. And then we want to say, hey, was this strategy, producing the result that we intended? Is that result good? Could it be better? That's a little bit of where sometimes you think about research and data and analytics and it can be a little bit, aloof, but that's, I think, where it comes to say, okay, how does that interface? How do you take things that we are putting in concept, a hypothesis, you could say, and then starting to get it from implementation and measure it?
Well, that's a great question, because one of the key things that we have that others don't is we have calibration on overall products being used, everything from capital equipment to obviously disposables. So by having the same materials and equipment and calibrating individuals on that, we can actually have cleaner data. So that allows us to actually concentrate on other things rather than just the clinician obviously using any product. We can actually look at that clinician and we actually can say whether or not that material is superior to another, because now everyone's been calibrated on that and we have an end value that they can't even produce at a dental school. On top of that, we can also then dig deeper into the charts where we're calibrating ourselves and doctors on overall medical and how we transform that and follow the Cleveland Clinic model. And we actually go deeper into it. And what it allows us to do is do a different type of data mining. It allows us to use certain rules that make us look at different characteristics. So you have co-diagnosis, you have obviously morbidities, but comorbidities, and you expand things out. And what really happens is you take pure data that obviously now allows you to really come to a proof of your overall hypothesis. And that's one of the things the PDA allows us to do, and we're going to expand that even across the pond in time. And that's where we obviously will have an advantage that no one else obviously can provide.
So I'm going to kind of go into one example, and we talked about this at Dr. Infusion, and we will get to PDA Academy, Dr. Infusion at some different parts in the podcast. But when you take something so fundamental as doing a restorative procedure, a filling, and a filling is something we learned very early in dental school, and it's something that you should be able to do kind of mindlessly. But then when you start to really determine, did I do this filling well? Did I do this filling with the highest level of quality? What are the different variables that you start to think about? And we talked at Dr. Infusion about complications. Did you do a filling well if the patient calls and they're sensitive? Or if the filling debonds, or if the filling breaks, or if it chips? And some of those may not be the clinician's fault or the material's fault, but maybe there are other elements at play. And when you can start to dial it in and truly determine, hey, we are getting less complications of whatever type because we have determined that this calibrated process is showing improved results over another process.
Absolutely, and as we spoke at Dr. Infusion, one of the key things was we just as simple as a restoration, whether it's a direct restoration following endodontic therapy or just obviously during regular treatment. One of the key things is that we go through the materials, the way they really were made and how that impacts use. For example, Prime and Bond. Prime and Bond we use as a Dentsply Sirona product, and it's not like others. And how you air dry is different. You don't take your air and go directly into the preparation because you can actually pull it out to the sides. The reason is because Dentsply Sirona uses another process. So instead of it being alcohol-based like all the other manufacturers, they are acetone-based. So the truth is you can actually bounce your air off your mirror and now get indirect so you don't get pooling and it actually evaporates at the correct rate. This obviously leads to better, tighter margins, and this obviously less post-operative pain. And those are the things that we're going to prove out because of obviously calibration and this use of certain materials.
So that's one example, but I think it defines well how a medical mindset, a strategy, we discussed as a doctor group, materials that we look to implement. And then this is where the data and the research comes in, is saying, hey, we believe this is going to do a good job, or we believe this can do an excellent job, and then we put that in place and create the measures. That's a very medical mindset, and we'll start to elaborate on that. Then as we talk about clinical operations and how does that interface with our doctors, these strategies, etc. Dr. Nia, I think, is incredible at helping bridge the medical concepts and then things that need to interact in a real world. We talk about the patient before they become kind of a clinical patient that's sitting in a chair with us. They're a consumer. They have a lot of different things that they're considering. They also have an experience that is related to, how they were clinically treated, but also what was their bill, what was the insurance parameters, etc. There's a lot of different departments, and clinical operations is the bridge between that medical mindset and collaborating with the practices and the business partners. So, Dr. Nia, maybe you can talk a little bit about your role and how that interacts in the company.
Absolutely. Well, first of all, thank you very much for having me on and to talk about this subject. I think, as George alluded, we are judged by the way we take care of humans, right? And I think we all recognize that to provide excellent care, there are other components that go into it. And, my role and kind of the goal that we have is to be a great steward of making sure that all those other elements are working in sync with the objective we have. And if our goal is to truly take care of people, we have to be mindful of all those other elements. And as you spoke earlier about NADG really giving us the resources to be able to operationalize taking care of humans, I play a role, and my goal is really to be a liaison between those two. And I think that being an organization that is really driven through the PDA, we need to have that clinical lens on as we look at those different elements that make up the overall experience for a patient. And I think if we ignored that, we would be naive, okay? Because the single shingle kind of, organic practice with the one provider, they're doing a lot of those back office elements, right? They've got the community CPA, they've got legal counsel, they're working maybe with a local agency on marketing and branding themselves in the community. And as we take those best practices and scale them and form these kind of economies of scale, we need to have a steward of that and making sure that we never lose sight of that clinical lens. We are here to heal humans. We need to have the best medicine and the best science to do so. But again, within my role and within what we do in clinical ops is we reconcile what happens from a business resource standpoint to providing care for that patient and make sure that we never lose our true purpose. And so, I think, again, you alluded to it, but I wanted to kind of, elaborate on that.
And I think that's a good way to, take what happens in concept and then operationalize it, and what are all the different, elements that need to occur. When you're in solo practice, you're wearing all of those hats. You're wearing the hats of all of those different resources that are needed. As we think about this medical leadership, and you just alluded to, clinical needs to be at the forefront of what we're doing. And effectively, the patient essentially is the goal. Absolutely. Healing humans, creating the best care possible. Coming back to that mission of best-in-class care every patient, every visit. There's a couple elements that come through in our PDA. One is an oral health board, so I'll talk a little bit about that. Another is the academy, and I think that's another area where what happens from our doctors working together and looking to continue to improve, and then what it also looks like, not just in an academy event or one of the programs that we have, but how that then bridges with mentoring. And I think that's another place that we'll jump into. So why don't we talk about that?
Well, Dr. Bruder does the academics. We do the drinking afterwards, and so I don't know where that plays a role. Is that mentoring?
Is that
as
in
well?
between? Is that bar time a little
That's
bit?
where we quiz them after a few drinks to see if they
That's where most of the real answers
Put it
come
to
from.
the test. But let's jump in, like the PDA Academy. I think it is one of the most amazing aspects of our organization. One, because the amazing individuals that contribute to it. Our academy is developed from our clinicians putting their expertise in front of our other doctors. Continuous improvement is, I believe, a requirement for a doctor of any role. Yeah, we have continuing education, check the box, you got your X number of hours per year. If you're looking for that minimum, fine. We give that fluidly, you can get that anywhere. This is an academy for development. So, Dr. Bruder, you really helped to lead that. So maybe you can speak a little bit to the academy.
Well, thank you, Andrew. But in your vision, it's being able to find the best available continuing education, but it's really more about life lessons and how that impacts whole health. You've always said, an individual can go and find the best CE, but they're going to take 50 CEs to find the one they liked. What we've really done is we've taken this and we've really concentrated our focus and found out the things that people really needed, and we've even gone beyond and brought the technology into it, which is, I think, really the key thing, and worked on workflows, digital transformation. This isn't just about going to a place and saying, oh yeah, do a root canal. No, this is understanding the imaging and how we assess things and how we actually make that patient feel they are the number one thing, and we actually increase overall experience for everyone. And that's what really impacts whole health and the way we deliver treatment.
The academy, you learn in an atmosphere that is classroom-like, etc. But what I think brings the academy to life is the mentoring aspect. And right. I know that as you have your team of dental directors, etc., it's probably the most important aspect of their role.
Absolutely. Listen, our providers are clinicians, and I think that there's a huge component to this kind of continual improvement process to grow people. And in dentistry, we want to help them be the best version of themselves, both clinically and as humans. And I think that mentorship and building community place to that psychological component, it actually adds the velocity to the knowledge base that they have. You can know everything, you could be a master in a process within dentistry, but if you can't connect with humans and you can't, operationalize and clinically actually flex that muscle, then what's the purpose of it? And so the active mentoring is really mirroring best practices, best behaviors, helping people understand how they can be the best version of themselves, to connect with humans, to be given an opportunity to utilize some of the tools that Dr. Bruder supports with. And so I think that like anything in life, you can learn how to throw the baseball, but I think it's through practicing and the coaching and the application of it where you really start going on that road of mastery. And I think that that's what mentoring means. That's what it really means to have that field support. A lot of times it feels like we are, serving more of to the psychology of that individual. But I think that that is such an important part of growing people, and we're successful because we grow people. And I think that what George does is very important, and I think we just get to kind of carry that ball and help that person,
And customize it.
Customize it, exactly. Because, and again, George knows this and you know this, we've had many providers, they've gone through our programs, they've gone through the PDA Academy, and the pace in which they're able to go out there and impact their community differs, right? But as long as we love them, as long as we support them, as long as we identify the barriers that they're putting in place or are there structurally, and again, going back to this, communication back to the team we have to support us operationally and help us, that can change the output and the outcome. And so it is our collective responsibility to do that. But going to the bigger point, that mentorship and really helping people be the best version of themselves is paramount.
I think that customized approach is worth just really defining a little bit. You have probably clocked more lecture hours than any individual on the planet in any type of healthcare. I think you've delivered more programs, you're on the road every single week, bouncing cities, doing really amazing educational events. But you also, I think, have contributed to really this mindset that we've had of customizing the mentoring side. We've profiled our doctors. There's emerging doctors, ones that we see as kind of new to their careers, a little bit more fundamental in their ability to apply and implement certain procedures. There's that individual, those that we are seeing in the prime of their career, 6, 7, 8 years out of academics and implementing it a different way. And then you have seasoned clinicians, somebody 20, 30 years out of education. Talk about how you're applying that in the academy events and what happens after.
And that's the key thing, because for many, it is snowflakes, and every snowflake's different. So what you want to do is you want to make sure that you hone in on the individual during the course, make eye-to-eye contact. Just like when you're presenting a case to a patient, you want to make sure it's eye-to-eye, knee-to-knee. Well, when we do these events, we make sure also that we are literally getting in there. We're talking to them on breaks, not disappearing off to a side. We do it a different way. When you go to an annual meeting, it's great, but guess what? Speaker wants to run away from you at the end. We actually look forward to the evening to discuss the things. Find out what they're really looking for, especially that seasoned doctor. The seasoned doctor has a completely different view of continuing education and the things that they want to take away versus a new doctor that just came out, and especially one who graduated during a pandemic. There's things that unfortunately some of them were never even exposed to. And if we can provide those things, like how to deal with an emergency, because some of them may never done the emergency rotations that we all did in school because certain states didn't allow it. What we've really done with the vision, that's it's always been here and what you've had, allows us to customize and really make, I believe, the best-in-class education that addresses everyone's needs, not just the new grad, not just the person that's been working 30 years, but it continues that lifelong learning process for everyone, whether you just started or you've been doing this for 30 years, and even identifying those things that a person that's been practicing for 30 years that they like to improve and see a different transformation in their office, a different workflow. There's always something that everyone's looking for. The key is the PDA finds out what is it that everyone needs and thirst for.
So we talked about the academy, and what I'm going to just reiterate is how the health board then interfaces with that from a strategic standpoint. There is a lot that we are doing in medicine, and there are different elements of how we want to say, what is our way? as a doctor community. When you think about hospitals and how they've evolved, you see that it is very evident when you have 2 doctors, 3 doctors working together. If the 3 of us go through a case, we're going to come up with a plan that is best for that patient, much better than if I did it by myself or George did it independently or
I think we're gonna come up with like 6 plans if us 3 did it.
might be 20. But coming to an agreement, you're going to find something that's, hey, the best solution. I brought something to light that somebody else missed. Doctors working together are going to create better. But
Grand
let's
rounds.
define that. Yeah, let's put that idea and let's put it into motion. That's what the oral health board is in a nutshell. We have committees and things like that, but we don't need to kind of define every single aspect of it. But we really are just intentional about saying we're going to interact with our care this way. So this is what we believe today. It should change tomorrow and thereafter because it should evolve. But today we believe that these are the things that we should be looking at for a patient. It shows up in things like our 5-step care cycle program. The way we want to intake a patient should be defined. The way that we want to evaluate the patient. The technologies that we want to use to help us come up with the best solutions. And then how are we going to execute that care? That is what the health board is. It's our partners, and we'll get to partners and that word in a minute. But our partners coming together, debating, discussing, arguing, fighting, whatever we might do, really kind of taking it sometimes right into the wrestling ring and really determining, hey, passionately, what is the best way to approach this? And then putting that into action.
Based upon the best available evidence.
And that's it. And those are the elements. Our health board is our community where our doctors work together. Different teams kind of dive into different aspects. Formulary and labs are constantly determining what are the best materials we should use, what companies make them, how do we work with them. Innovation committee, the 3 of us were all sitting in that meeting today going through, hey, artificial intelligence is here. How do we incorporate that? What company do we want to partner with? That's what the oral health board's doing, is taking these ideas and coming up with a proposed strategy, and then taking those strategies. And Frank, this is, again, where clinical operations, I think, really is important, is taking it from a thought into implementation.
Absolutely. I think you brought up a great point. I mean, the oral health board, is really an ability for us to collaborate in an organized way. Otherwise, we're going to have organized chaos, right? We've got a lot of great thinkers. We've got a lot of great clinicians. There's a lot of best practices. And I think that our ability to kind of take those thoughts in an organized way and create standards is a differentiator. And I think that the word a board really represents thought leaders coming together and defining something. And I'm very proud to be a part of that and to be able to get that output from the board and to really then partner with the right lens, that clinical lens, with the end customer in mind, our patients, where we can then operationalize it, tap into the resources we have at NADG, and really, create that vision that we want. And so, absolutely, when it comes to strategy, it needs to be defined from best practices. There's no place to get better information than from that board defining what the objective and the strategy needs to be, and then really turning it in the hands of people who operationalize it, put strategy in motion. And in the business world, strategy always has the momentum baked into it. And I think that for us, it's a little bit different. We really come up with the concept, we come up with that seed idea, and then we're able to bolt on that momentum with the right lens, again, never forgetting who we serve as our customer, which is really the patient. So that's a great point, and thank you for bringing it up.
I think that, so in my opinion, I think the 3 key pillars to the PDA, and hopefully if you take anything from who we are and what we are, it is that medical group. One key aspect of it is the health board. I think that's the strategic definition of where we want to go. Always just working through that. Then you have to educate, right? If this is what we have in mind, we have to take those systems and put them in action. The academy isn't just education for the sake of CE. It's education according to concepts that we calibrate, to your point. And there's another key element to the company, and this last one is where we'll kind of wrap up this episode. It's partnership. partnership is really threaded in our company. Probably one of the most exciting times in the company is our partner meetings. It's when they get together. The ones on the fly at the bar where we're hanging out in Chicago, or we're hanging out in Georgia, or we're hanging out in New York. And there's just, when partners get together, it's a blast. And there's also a steering committee. Our partners, now we have over 140 doctors that are partnered together in this company. And they have nominated a council of individuals to kind of make sure that everybody's voice is being brought to the table. This oral health board can be this like, okay, who's on that? How do I get there? And there's a lot of partners. How can my voice? This is us making sure everybody's voice is heard. So there's a partner council to bring that stuff to continue to help steer us, that doctor leadership in action. And I'll ask you both to kind of give your thoughts of how this company's partnership and what that means to you guys. And hopefully it'll give that sense of really who we are.
Yeah, I mean, that resonates with me a lot, and that's one of the things that I'm really, really proud of what we've built here. There's this term of a DSO out there, right? And I think that the dental service organization is not reflective and does not embody who we are. We're a dental partnership organization, right? We're a DPO, right? And what that means to me is when you've got 140 people that are not only culturally aligned, they're clinically aligned around the PDA and the Oral Health Board, and also financially aligned to make sure that when we do good in the communities we serve, we all benefit, right? That's a tripod of success. And I think that, to me, partnership means that harmony. It's the partnerships you have in your life, whether it's your spouse or partnerships you have within the community. It's just not a business sense. And I think that what I really, when I reflect on it, makes me proud is these partners are not just financial alignment for me. They're really a part of my life. It's people I serve. And I think that that's a great thing that, we have going for us.
Well, thanks. Last week was phenomenal. So last week we were at Charlotte, we had Dr. Infusion, and just the energy of that group. You could see individuals that just met each other for the first time, but honestly being together with NADG and seeing what it really stood for, learning more about the PDA, how we were going to support them. Coming from full-time academia, I can tell you, unfortunately, you go to school and we all know it, you have to say doctor, XYZ, but the day you graduate, all of a sudden everyone's a doctor. With NADG and the PDA, it's different because from the day you walk in, you're a doctor. You are someone that every one of us want to interact with, and we want to support you every way we can, both clinically, socially, and even more importantly, in your life decision, financially, independence, etc. There's a partnership that just doesn't come out of dental school. Every one of us, we know the truth. How many of you really ever had a business class when you were in dental school? How many, unless you had your MBA, doing an MBA while you were in dental school, we never learned practice management. The only reason you got practice management is because the individual whose practice was doing so poorly was available on Friday morning. So the dean said, go ahead, every other week you talk to the seniors and give them a practice management course. That's probably not the person you wanted to learn it from. I think the partnership and the way everyone honestly is embraced by NADG from the time that Dr. Concierge starts, the way that honestly Kerry and the handoffs now that are occurring, this company is doing something that no dental school honestly ever dreamed of. It's not a DSO. Frank, to your point, absolutely not. DSO is the worst term in the world. This is an organization that supports you in your life and the way you literally interact with your community and provide care for them. And that's a true partnership.
Well said.
Well, I think that's a perfect way for us to kind of bring this podcast to a wrap. It was great spending time with you guys. We battled it out earlier, kind of going toe-to-toe on some cool decisions around innovation, etc. I won that cage match, by the way, just for the record. Maybe I think we have a video of that we can show in a different episode. But Between the Chairs, it's back. It's kind of newly restructured. We've got this cool studio. We've had a lot of people contribute to really make this great. But more than anything, it's just, want to make sure that everybody has a good appreciation for the PDA. And from here, we're going to take the podcast in different directions. We also have At the Chair that we are launching. At the Chair is really showcasing the amazing healing humans that you always talk about. That's what we do, right? We're interacting with patients, so it's going to showcase that. And we have a lot of amazing life-changing cases that have occurred and we're going to make sure we bring those to light. So, Dr. Nia, Dr. Bruder, thank you guys.
Thank
Thank
you.
you very much for having us.
All right.
Really appreciate it.